Senator Ed Hernandez is the chair of the Senate Healthcare Committee. He has been a leader in a number of ways, leading on, I would say, issue-specific legislation like farmer price transparency, but also leading on big legislation like the implementation of the Affordable Care Act, ranging from creating exchanges to essential health benefits. And as I said earlier, I think if we look back in the history of California, there may be no more influential policymaker, public elected official for the healthcare space than Senator Ed Hernandez. With that, let's give him a round of applause and welcome to the stage. Senator. Yeah, thank you.
Appreciate it.
Good. So, is that right? Are you, I think it's accurate that you are the most consequential policymaker, maybe in the history of California. Why don't you walk us through some of the stuff that you've had a hand in since you were elected to the Senate in 2010 and became Senate chair?
So if you say that, I agree. Isn't he right? If he says that, it's truth, right? Anyway, thank you very much for that kind introduction. And, I'll tell you what my life work has been. For those of you who don't know, I'm an optometrist in the state of California, and that's what prompted me to run for office. My frustration of the healthcare system we had, getting elected to the state assembly in 2006, and then in the state senate in 2010. But here's where things really, what I feel, opened up the whole world for me. The day I got elected to the state senate, I was appointed chair of the Senate Health Committee, which was my dream come true. So because I've been able to have a hand in various legislation, I also think that I'm very lucky. And let me tell you why that is. Because right after I got appointed as chair, that is literally post-signing of the Affordable Care Act, and being the chair, having the resources, this incredible staff that I was able to put together to be a part of every single healthcare policy in California, that is. And I will say, I'm going to brag about California. Because California is so big, we've been a leader. Yeah. So let me tell you what we've done in California. First, to have an exchange, not any exchange, an active purchasing exchange. This exchange has signed up more individuals than any other state. We have dropped our uninsured rate by half in California, and despite the uneasiness that's going on the federal level, we've been able to keep most of our rating regions fairly competitive. Most, if not all of them, have more than 2, possibly 3, 4, or 5 plans competing within it as well, but been able to be author of the 10 essential health benefits. Mm-hmm. The consumer protections that all of us have here in this state through the Affordable Care Act. So every piece of healthcare legislation I've been able to be part of, but also to look at other issues that are important. Access to care and controlling healthcare costs.
Yeah. What was the biggest lift, during that process? Because there were some big bills and the governor was, had a mixed level of interest. Mm-hmm. And sometimes the biggest enemy is not the other party, but it's the other chamber. Right. What was the biggest lift in terms of healthcare legislation in the last 8 years?
So because we're in California, it's a blue state, obviously, me being a Democrat, chair of the Health Committee, we've been very fortunate because we've been able to pass legislation on a fairly easy route. Some of the bigger ones that I come to mind that are tougher are issues that dealing with 2/3 vote where we need Republicans. Mm-hmm. For example, when I was the author of the MCO tax, for those of you who know, it's the Medi-Cal Managed Care tax that we drew down $1 billion of federal money. But not only that, we brought the plans together, the consumer groups, so we were able to do that. That was tough. But two of the bigger ones that I was involved with is the first one was taking on the tobacco industry by changing the smoking age from 18 to 21. Think about the health consequences that we're going to have in the future for young adults who won't get addicted to tobacco. But the biggest fight was taking on the pharmaceutical drug industry to bring some transparency and control healthcare costs. And that one, fortunately, was a bipartisan measure that got signed into law by the governor.
Yeah. Why don't you tell us a little bit about this legislative session? It'll be your last as a senator for at least a little while. Right. Tell us about some of the ups and downs, the bills that you worked on that got out of committee, out of chamber, sure, out of the legislature, and onto the governor's desk.
So I think just as a whole, the Assembly, the Senate, and even the administration we've been on the defense because of what's happening at the federal level, the attack on the Affordable Care Act. But because California has been so successful in its implementation, I think we're going to ride that wave, okay? So there's been a lot of what I would call defensive legislation, but the things that have come from the legislature through the budget, finally, we're putting some money in the budget, which I've been trying for the last 12 years, to put into what's called an all-payers database. That's important. Finally, I've introduced legislation numerous times to put together a commission to strategically look at how we get to universal coverage and control costs. That's in the works. But like what I've worked on is to ban junk insurance, which is sitting on the governor's desk, because we all know that having junk insurance literally is not good insurance because it puts the onus on the patient, doesn't guarantee their coverage, doesn't have any lifetime out-of-expense expenses. But the other ones I worked on was, which I think will get a signature, I hope, is to, when the Trump administration said that states can require work requirements for Medi-Cal, my bill will be the opposite and says, no, we want to make it easy for everybody. Then another final one, which is becoming a real problem here in our society, is our homelessness problem. And there's a lot of homeless dumping that's occurring where hospitals are discharging patients. So when this bill, if it gets signed, will be the first in its kind that's going to set the floor of what hospitals are required to do to make sure that these patients are taken care of.
Even in the best case scenario, when you're lieutenant governor first, and then something else maybe later, you won't be, as I said, you won't be a senator.
Right.
What will you miss most about serving in the legislature?
You know, it has been this incredible experience. You know, I never imagined, first of all, running for office. I'll tell you what, the only thing I ever did politically is, you know, I voted regularly because my father instilled that in me. I read the newspaper and I watched the news. But it was my frustration of what's not going on in my community. My community is predominantly Latino, lots of Medi-Cal patients, poor reimbursement rates. I'm sure you heard that over and over throughout this conference. But it has been this incredible, incredible experience serving the public. But what I hope will happen, and if I become the next lieutenant governor, is take those relationships I've created over the last 12 years, my experience in health, and actually continue to do the work to be able to do that goal. And I had a very, very nice and interesting conversation with Gavin Newsom, and to just do that. And hopefully we'll work together and make that happen.
Yeah. You've told me a little bit about that conversation. Why don't you tell us a little more of the details of the conversation?
Sure. So
betray all those confidences and just share it.
So it was literally, you know, about 3 weeks ago, he was going to be speaking at the Latino Caucus, which I'm a member of, and I was coming up the stairs. He just got off the elevator, and I said, Mr. Lieutenant Governor, congratulations, you know, on you winning and hopefully becoming our next governor. And he did say, you know, we got to do something about this cold relationship between the governor and lieutenant governor. He didn't, you know, endorse me, he didn't wish me luck, or he just made that comment. I go, well, thank you very much. If that happens, I want to make sure you're successful. I want to work with you in your administration, but I'm going to make a proposal to you. I propose to you that if you restore a budget that gives me the tools to travel the state, have hearings, I can work with both chairs of both committees in the Assembly and the Senate. I have all the contacts where the interest groups that are consumer groups, labor, health plans, providers, like we did when we took on the pharmaceutical drug industry, like we did on tobacco. I will assemble and work on trying to control healthcare costs. I will work on trying to get to the point where we have universal coverage and get to the point getting past all what's happening at this federal level, and I want to be a partner with you. And he seemed open. He didn't make a commitment, but I made it very clear that I want to continue the work I've done in the last 12 years.
Yeah, do you want to maybe just share some of your vision for that? You've already done that a little bit, but maybe build on it and expand. The role of the lieutenant governor, as you know, is really open for interpretation by the member that holds the position. How do you see that, in addition to convening meetings and driving the debate? Are there additional ideas about how you think you might use that office?
So you made a comment, it's kind of open to debate. Here's why I'm running for lieutenant governor. It's because it gives me the bully pulpit to do anything. Yes, it's true, the lieutenant governor sits on the UC Board of Regents, CSU Board of Trustees, which is very important. I think education is the most important thing when it comes to workforce. And by the way, we need to look at creating a workforce to be able to see these patients, whether it's providers, whether it's nurses, et cetera. But here's what I can offer and what I can do. The 12 years of legislative experience, the budget process. You had mentioned you had Holly Mitchell here, work with the budget process to make sure we have money to do exactly what I talked about, looking at all payers' databases. But if you think about where we're at in California, we're just under, just under 8% of the population's uninsured. We have to figure out how we take the excesses and what we're making and then making sure that we can make sure that we get more people insured. But the most important thing we have to talk about are two things. Number one is access. Let me tell you why that is. Doesn't mean anything to have an insurance card if somebody who's from South Central Los Angeles, East LA, the poorest part of the Central Valley, unless they have access to doctors. We have to look at that. But we have to have the political courage to talk about controlling healthcare costs. Mm-hmm. And that's what we have to do. We have to look at whether it's monopolizations of markets, we have to look at pharmaceutical drugs. The dialysis industry is making tremendous profits at the expense of consumers. We have to have those conversations. And I think my experience in the legislature, working with the administration, can help make that happen.
Tell us about just the nuts and bolts of the campaign. How is that going?
I'll tell you, it has been incredible running statewide. I don't think I have slept in our bed, my wife and I, home for more than 2 nights in a row. Yeah. I've been blessed. My wife and I have been married 33 years, and she has put up with me through all this craziness. And she has scaled back her work schedule. She's an optometrist as well, to working a day a week. And we have traveled every single part of the state. It's daunting, but it's just opened up my eyes, because the LA is different than San Diego, different than the North Coast, different than Fresno or Bakersfield. It is just this vast, incredible state that we have, and it's been an exciting journey.
Yeah. What has been the biggest surprise about this campaign? I mean, campaigning statewide is different than campaigning in a legislative district. What did you not see coming?
Yeah, I mean, the nuances are the same. The building blocks are the same. You've got to meet people, you got to raise money, you got to mobilize, and you have to have a message. Mm-hmm. Except it's just much bigger. I think the toughest thing is just how physically demanding it is. I'll start 7:30, 8 in the morning. Tomorrow I got an 8 o'clock meeting, and I'll get home 10, 11 o'clock, 12 at night, and it's just tiring. Just a big, ongoing process.
Yeah. What do you think people are missing about this race? If the key sort of maybe differentiator between you and your opponent, or the key message or the key question that voters should be asking that results in you being the answer. What is that question, or how do you differentiate yourself?
Well, that's easy. I'm the best candidate, right? Right? Yeah. No, I'm running against another Democrat. I think the key difference is this. Is the fact that, I pull myself up through my bootstraps. I was a teen parent, went back to college, 3 years of community college, worked full-time, 3 years of Cal State Fullerton, worked full-time, chose the Cal State system over the UC because it was less money, got a scholarship to become an optometrist, opened up my practice from nothing, served in the legislature, have been 12 years in the legislature. Not only my experience, what the common person in California goes through, but more importantly, what I've gone through as a legislator, compared to my opponent who's just literally trying to buy the equation because the election because they're independently wealthy.
Yeah.
To me, that's the key difference.
Yeah. There aren't, it is sort of funny to think about an optometrist being a middle-class person, but certainly compared to a Greek magnate's daughter or shipping magnate's daughter or whatever, construction.
Well, what I meant is how I grew up and how I started.
Yeah.
My grandfather came to this country with a 3rd grade education, an immigrant from Mexico, worked construction, labor's local 300. My dad, I'm fortunate, is still alive. My mom as well, worked in a factory. I grew up in a middle-class community, had to struggle to put myself through school. I think that's what this country's all about, you know. And I believe that a public education is the greatest, is the cornerstone to democracy, but I also believe that a higher education is the greatest equalizer. Because where else can somebody like me achieve what I have and be the next lieutenant governor if it wasn't for this great public education system we have?
Why don't you talk to us about the federal model and the current administration in Washington, D.C., Gavin Newsom, should he be elected to governor, has an opinion about the role California should take vis-a-vis the federal government, and as the state's CEO, he'd be the point person on that. But just your thoughts on how to cooperate or to check or to balance the federal government if you serve as lieutenant governor.
Well, I mean, it's no surprise to all of you here. Obviously, I'm very disappointed on the direction our country's going. Let me tell you why that is. My entire life, I've never seen more division than I've ever seen before. The attack on women, attack on the environment, the attack on minorities, whether it's Muslims, Latinos, the fact that, statements like build a wall, they come over here because they're drug dealers and they're, this is not what this country's about. And that's not what California is, and that's what makes California so great, is its diversity. So if the federal government is willing to have a conversation to really get to the point where we're going to control cost and really, really get to universal coverage, I'll have it. But if not, then I will be that agent with the administration to oppose. I think right now the federal government is really trying to overturn the Affordable Care Act, which I would be adamantly opposed, do everything I can to stop that. But let's think about what the Affordable Care Act is. There's talk about single payer, but what is the Affordable Care Act? It's a Republican model. It's a private-based system with subsidies from the federal government, but there's competition. I mean, how much more, conservative or how much more Republican is that? I'm a huge defender of making sure that it works, and we have a president that's trying to destroy it.
Yeah. I want to make sure that we take questions from you all so that you can participate in this conversation as we've done earlier today. So you're not a shy group. I know if you have a question, let's make sure we can raise it. I see one here.
Maybe we'll get a mic over here.
Margie's going to bring up a microphone. So again, sir, just identify yourself and your outlet, and we'll have Senator Hernandez take your questions.
Well, I'm being prompted for a cost question. I'm going to actually ask about pensions. But
Sure.
Hi, Garen Corbett, University of California, and I've worked with you in your committee, so thank you for all your hard work. I had a question as you're thinking about a long list of priorities for the state of California. How do you reconcile that with some of the looming fiscal realities of funding for education, pensions, healthcare cost, and how do you sort of reconcile those about, do we, in terms of strategies to keep the California economy growing high, at a rate that can support the tax revenue to meet our fiscal liabilities and promises?
I mean, obviously, I believe in healthcare. I would continue to advocate for that. I think we're almost there. We can do it with the resources we have. But let me tell you, governing for the last 12 years and the fact that we are the sixth largest economy or fifth largest economy in the world, we have passed an on-time budget consistently since the recession has been passed. I think last budget cycle we did a $138 billion budget. We are putting money away. But let me tell you, there will be a recession. And what I really believe that we need to do is just make sure that we have a continued revenue source. I'll tell you one thing about this governor, which he has done an incredible job. He has taken his fiduciary responsibility so serious, such that everything he decides and what he feels is when he entered, he wanted to leave it in a much better fiscal position than it was when he left, which I think that's the case. But I also believe that if you look at the California state budget, it's based on the values of who we are as a legislature, and I think we need to continue to make sure that that happens. And in the event that we do have a recession, we're going to be faced with some tough questions. And you're right, where are those cuts going to come from? And we can't predict how that's going to happen. But I think somebody had mentioned pensions. Maybe you were going to be. You had asked him to talk about pensions. So let me tell you something about pensions. So here's the deal. We have what's called an unfunded liability. And if you think about all of you who buy a house, let's say you have a 30-year mortgage, well, you can afford your mortgage payment, but your unfunded liability is the overall amount of money you're going to pay for that. The state of California is meeting their unfunded liability obligations, and I think about 60% of it is within what the state has to pay with the match of the various entities. But here's the other thing, about 40% of it comes from healthcare. And the healthcare, it's not an unfunded liability, but it's a payment as it goes along. And if we control healthcare costs, it's going to help our pensions as well. But I'm going to just say one thing, that if we make a commitment to our public employees We need to make sure that we continue with that commitment. And if we are going to change anything, it should be done at the bargaining unit, and it should be for new hires. Because it would be like, promising you Social Security, and then they pull the rug out of you in the future. But California will make sure that we maintain those and pay those liabilities.
I'd like to ask
here, and then back there.
Okay, I'd like to ask a question about the Patient Protection Affordable Care Act, Obamacare.
Name and your organization, sir?
Michael Monaski.
Yeah.
I'm a writer. Anyway, the new health plans that have been proposed by J.P. Morgan Chase, Amazon, Berkshire Hathaway, it's been said, which are not unlike Kaiser in their proposal, have been said to be the symbolic end of Obamacare. I'd like your comments on that.
A symbolic, did you say end?
End. Yes. Termination of
Termination.
Obamacare.
Well, unless the Congress of the United States and a president signs a bill that changes the current law, that's not the case. As I know right now, when I woke up this morning, we have the law of the United States of America in statute in the state of California that there's certain parameters that need to be met. Number one, every single person has consumer protections from guarantee issue, be able to get insurance, max amount of pocket expenses, from 10 essential health benefits. That's the reason why I introduced the junk insurance bill, because we have to abide by the law of the United States of America, and that's the Affordable Care Act. I don't see that ever changing it. I don't care what plan that is.
Yeah, great. Go ahead, Amy.
My name is Amy Loffin. I'm with Inside Health Policy, and you just made a great segue into my question, which is, have you heard anything about what's going to happen with the short-term bill and also the dialysis bill that are both sitting at the desk?
So they're both sitting on the desk. I'm optimistic. I will never speak on behalf of this governor because he ultimately makes those decisions. We've been having very, very good conversations with the administration, but I hope and I'm confident he'll sign it for a couple reasons. Think about what this governor has done. This governor, number one, has signed every single healthcare bill which instilled what you've talked about in law here in California. He signed the Medicaid expansion, which I was the author to it. He signed every healthcare bill, so I don't see him not doing that. He's made publicly very clear that he's opposed to what the Trump administration is doing, so I hope he signs it. With regard to the dialysis, you're talking about the LEVA bill. Is that the one that would, so in other words, if a dialysis company were to get a patient to go to a private health plan, that they would be reimbursed at whatever they would have been reimbursed from whatever, yeah. So that's the LEVA bill, and I don't know the exact number. What's that? 1156, but I'm very, very supportive of it, and here's the reason why. We always talk about controlling healthcare costs. The dialysis industry sees Medi-Cal and Medicare patients. Kidney disease is I think, I could be wrong, the only disease that you can get under the age of 65 and get coverage through Medicare. Medicare sets the rates. They get good quality care whether they're Medicare and or Medi-Cal Medicare. What the dialysis industry is doing is they're taking those patients and encouraging them to go to Cover California and buy private insurance, and they'll subsidize it. They're charging significantly more. To me, that is totally inappropriate because that's at the expense of the consumer. So what this bill says that if you do that, you're going to get reimbursed at this rate. We have to talk about how we're going to control these out-of-control costs. Because what's happening, this patient's thinking, oh, I'm going to get better care, but in reality, everybody in this room is paying for it in the form of higher premiums. So I hope that it gets signed.
Good. Other questions? Rita, where are you? Right here. Great.
Mimi Grant, the ABL organization. You've mentioned controlling costs, and a number of these bills, both that you've put in place and that you're discussing now, are excellent towards that. What other things are not already in the legislature that you're anticipating over the next 4 years could reduce the cost of quality care in California?
Sure. Something I've been talking about for the last 12 years is creating some kind of all-payers database. We eventually want to get to some kind of care where it's coordinated care, because that's the care, what I believe, and I think CAPG's here, and I know they changed their acronym, but the model to get to control costs is by incentives to keep people healthy and coordinating the care. But by having an all-payers database, you're going to start to be able to look at what the true costs and compare different procedures. But the other thing that I think we have to do is you have to look at outcomes. Okay, so I'm just going to say if you use hospital A to do a replacement surgery and you do hospital B to do the same surgery and hospital A charges this much more, but the outcomes aren't any better, then something needs to be changed there. So we have to look at controlling costs through what I would call an all-payers database. The other thing that we have to do is we have to look at consolidation of markets. And here's the reason why. Is since the implementation of the Affordable Care Act, you have seen this huge change in market shifts. You're seeing health plans buy up health plans. You're seeing medical groups buying up medical groups. You're seeing hospital systems buying up hospital systems, which is good. I believe we need to have an entrepreneurial system, but they're doing it to have scale to be able to compete. Okay, well that's good as long as they have scale to compete and it benefits the consumer. But what happens if you have monopolization and you have an increase to cost? And I think that occurs in the dialysis industry and in many cases in the hospital systems comparing Northern California to Southern California. Why is it that hospital costs in LA are less? Because there's more hospitals. So at what point does government step in and say, we need to control this? And I think there needs to be that conversation. And the reason why I say that now is because we are mandating, as long as this is still the law of the United States, that everybody have health insurance. Now, if you have an iPhone, I'm not mandating you to buy that. You can choose to get it. But if you have no choice, then perhaps government should look and say, okay, well, we got to make sure everybody gets the best price that we can get for the consumer. We have to look out for the best interest of the consumer. So those are the issues I think that we need to address.
Other questions? Tell me, I'm always interested in breaking down this idea of big government as being detached from the human experience, meaning you've got a mortgage, you've got a job, and you do all these things, and you're a legislator. What do you think people miss in the gap between legislating and advocating? Meaning when they come to you or they come to your colleagues' offices and they get fired up about something, what is the best way to sort of speak to legislators, recognizing that they're human? I mean, a lot of people get mad when they come to you and they want to yell at you and all that stuff. How do you recommend people who want to stay in this fight after you leave the legislature continue to engage the legislature moving forward?
So let me give you what my perception is now that I've served. I really believe, I don't care what level of government, city council, water board, school board, Senate, Assembly, Congress, whatever. People who get elected to office are a reflection of the communities that they come from. That's it. It's real simple. Let me also tell you, you've heard all the extremes, the horrible stories about, fraud, abuse, kickbacks, special interests. I've come to realize that we elected bodies are not only a reflection of society, but you have very good legislators and a few bad apples, and they represent who we are as a people. And I will get to the question, but more importantly, I don't care how dysfunctional it may appear, this is the best system in the world. And let me tell you, legislators from all walks of life put on their clothes the exact same way as everybody else, and my answer is you have a right to advocate, you have a right to speak your opinion, go see your elected representative and voice it. They listen to you, they should, and if they don't, vote them out, become active in the political process, vote, and be an active participant in government. We take calls all the time and look at, what's going on in the community. They will listen to you. They better listen to you because that's their job and they're elected to do that.
I got to say, we have been really honored at State of Reform to be welcomed into a number of communities. We host this conference now in 9 different places: Sacramento, LA, right. San Diego, 6 states total, and among all of those states, we see all different types of legislators and all different types of advocates, and we respect them all equally. First among equals, though, is a short list, and you're right at the top. I think that Your approach, your authenticity, your leadership on this issue is consequential. And we have learned that elections have consequences, and the priorities of the elected officials who come into office carry the conversation forward during their term. I know that if you get elected to Lieutenant Governor, healthcare will continue to be a priority for the state of California. Thank you very much for your service, sir. Thank you for being here. Let's give him a round of applause.
Thank you very much. It's a pleasure. Thanks for having me.
Thank you.
Yeah.